You're tuned in to Lifelong Learning on ReachMD. I'm your host, Alicia Sutton, and today we are broadcasting from the annual meeting of the Alliance for Continuing Education in the Health Professions. And this will be a fun dialogue because we're going to talk about Google, or at least specifically Google Hangouts and Hangouts on Air, and how they can be used in education, both professional education and patient education. There are a lot of new learning technologies available in healthcare, and Google Hangouts on Air is certainly one of those tools. But what are the benefits of it, and how can clinicians use it in education, both for themselves and their patients? With me today to explain the pros, cons, and everything we wanted to know about it are Derek Warnick. He's the Senior Manager of Healthcare Education at Pfizer, and Scott Kober, who is Principal at MedCase Writer. Both are located in Philadelphia. Welcome. We're glad we could have you guys here today.
Thanks for having us.
Yep. Great. So let's start with the definition, Scott. What's a Google Hangout, and how is it different from Google Hangout on Air?
So a Google Hangout is probably most akin to what people would think of as Skype. So you have a group of people that you can invite into a closed room. You can do it with friends, you can do it with family, but it is not broadcast or viewable by the external world. Whereas a Google Hangout on Air, you have the same capability to invite anybody in to be a speaker, presenter, or within the Hangout itself. But the broadcast is not only viewable by anyone in the external world, but is also automatically archived on YouTube afterwards so that you can watch the broadcast when it is complete.
Okay, so Derek, just to clarify, a Google Hangout on Air is a private learning environment in the sense that you have to be invited to be a presenter, but anybody can view it in a live broadcast if they have the URL. Is that correct?
Yeah, it's basically right. In order to be part of the Hangout, they definitely your presenters have to get a specific link to come to. No one can really be on the Hangout as a faculty member speaker without you having given them that information to access it. And then those who are watching the on-air version of it, it can be anyone. You do have to let them know of the URL. However, Google Plus is a social network, so it is set up to be open for anyone. There are ways to make it private so that others can't access it, but in general, it's open for the public to be able to watch, unless you make it more specific for them.
Great. And Derek, how about some pros and cons of that platform?
Sure. So I think some of the advantages, 3 big advantages of the Hangouts. One would be that it's easy to learn how to do. I mean, Scott and I have done about 50 faculty or so with it, and we've always been no one's ever had an issue where they couldn't figure out how to use it. So it's easy. Another really big one is that it's free. So that's very cheap. Can't get any cheaper than free. So that's, of course, the big advantage. And then the third one is that you can participate in a Hangout both as someone who's watching it or someone who's actually on the Hangout from anywhere, as long as you have a Wi-Fi connection and can get online. So they don't have to travel, and they can do it from their office or from their home, anything like that. As far as disadvantages, there's not a lot, honestly. There's a little bit of a learning curve for people who have never done it before. There's a little bit they're going to have to learn how to do. If you're the person producing it and you're used to nice pre-packaged modules of this type where you're not doing anything, you're just hiring someone to do all the work for you, this is a totally different animal. You have to do the work yourself, so it's not a nice, neat package like some of them are. But overall, the quality is great. The pros definitely outweigh the cons, in my opinion.
Yeah, it sounds very interesting. So, Scott, can you give us some idea of some professional education that you have seen using this?
Sure. So I've been a part of several professional education events where we use Google Hangout on Air as our delivery platform. For several of them, we did do an actual live broadcast. So I worked with faculty members to develop a number of cases. So we had a short slide deck, but it was really mostly geared towards them having a panel discussion and kind of having discussion questions of specific issues with these patients. People could text in their questions during the broadcast itself. As we talked about before, immediately at the conclusion of the broadcast, the session was archived on YouTube. And so that's one way that I used it. I've also used it in kind of in more of a closed form, so that it was not broadcast to the public, but we were able to capture the video interaction between the faculty, and then we did some very kind of simple editing on the back end to kind of chop it up into pieces and built the educational event around the various segments that we gathered using the Hangout on-air platform. So there really are a lot of creative ways that the platform can be used, as Derek said, with the benefits of no travel, no cost. They're really, as long as kind of you think about, okay, what is the best way to use this platform? It's not going to be great if somebody has 60 slides that they want to go through in 15 minutes and try to give a traditional didactic presentation. That's really not what the platform is good for, but it is really good for bringing groups of people from or individuals from around the country, around the world together to talk about a specific issue or a specific set of issues.
Right. It does sound like a good platform for what you do well, which is cases. So a simple case, not too elaborate, and get a lot of dialogue going.
Absolutely. And I think, when you're working with faculty and physicians and other healthcare providers who've never used it before, initially they're gonna be a little bit reticent perhaps and a little bit nervous about it. But what you find is it's incredibly simple. All that you have to do is click the URL that whoever the moderator sends you or the organizer sends you, and you're in.
Yeah, and I imagine those who are presenting are finding it easy to quickly adapt to this learning module, this model of displaying information.
One of the most common responses we've gotten back from faculty after they've gone through this is two things. One, that they're surprised at how easy it was to do. Often it's like, oh, that was it. That was not hard at all. The second thing is the quality of the end product. I think they're often surprised by that as well, that something, again, it's a free tool, can produce this kind of quality.
Yeah, that's good. That's good to know. If you're just tuning in, this is Lifelong Learning on ReachMD, and we're discussing Google Hangouts on air with Derek Warnick and Scott Kober, and I'm your host, Alicia Sutton. So, Scott, you gave us a good example of professional education. How about on the patient education side?
So I think it can be used in a very similar manner. There are many examples out there of health systems who have gathered several of their physicians kind of all talking from different locations to discuss a topic of interest to their patient audience. And it is a good way to be able to potentially reach the patient audience with the live broadcast, but I've seen it a lot more that they will then embed the YouTube video afterwards on the hospital website. And you can absolutely, if you want to, you can invite patients into the discussion if you want them to offer their viewpoints on a specific issue. So again, I think it goes back to, it's a great way to, get that video collected and then posted in a very inexpensive and high quality manner.
Right, yeah. I remember seeing the Cleveland Clinic website had done a good program on diabetes and obesity, and certainly we're seeing it pop up more and more, I think, in hospitals.
Yeah, and I think, as more hospitals and as more clinicians kind of learn how to use it and kind of the best ways to utilize the technology, I think you're going to see more and more who will kind of turn to this platform just because of the ease of use and, as we've said over and over again, the negligible cost.
Right. So here we are at a CME, or a continuing education conference, and I'm curious, Derek, if you have any insights on how do you measure engagement on this type of platform?
Yeah, both with Google doing the live version and then the archive that's available later on YouTube, both of those have very robust analytics that are already built into them that you can see anything from how many people participated to how long they spent on the activity, so you can see which ones kept the audience engaged for a longer period of time than others, time of day, where they were, how they found access to that program, if they were coming in from, someone tweeted out a link to it and they clicked on that and found the activity. So all of those sorts of participation metrics are available as part of the normal package that comes with it. There are some, to get more in depth is a little difficult, as we all struggle with that sort of thing. There are ways within the Hangout itself, there's a Q&A tool that's available that allows you to ask questions to the audience and they can be responding in real time. Those who are actually watching it, they can click on a link within the video itself. That's a little difficult just because they need to have a Google Plus account in order to actually be able to use it. And with the audience that we've been involved with anyway, that's not a large portion of the audience. So to actually measure that level of engagement is a little tricky, but you are able to find out fairly easily how many people are participating and those sorts of metrics.
No, that's good to know. Google Analytics, I suppose, is a little bit of the backbone on some of the data that
Sure.
you're getting from there.
Yeah, and they're constantly updating and improving it. There's probably things new on there now that I haven't even looked at yet, just haven't had a chance to go in, but constantly improving what they're offering, which is the great thing about working in something at such a large capacity is that they are always striving to make it better.
Yeah. Scott, what do you see coming down the road as we look at technology, the evolution of this type of learning?
Yeah, so I mean, I think that certainly Google Hangout on Air is just one example of kind of the ways that technology has really kind of, you're closing the gap, whereas 5 years ago, we would have to fly 3 people in from around the country, schedule them 6 months out, get them into a studio, spend tens of thousands of dollars to produce something that would look like a professional quality webcast. Now you can use Google Hangout on Air, schedule it, a few weeks out when people are available for an hour and do it for free, and the quality of the actual output is more or less going to look like a studio quality event. So as we move forward, as we kind of learn more, as more technological tools are out there, it's just a matter of thinking about, okay, is this something that I can incorporate into my personal and professional life? And if so, what is the best way to utilize it? I think we all have probably examples of tools that we thought were going to be effective, that we tried and said, yeah, this really doesn't work for me. Mm-hmm. But Google Hangout on Air has really been great for myself, for Derek, and for a pretty large swath of the healthcare community that has really learned to embrace everything that it has to offer and take advantage of the advantages that the platform does provide.
Right. So maybe some of our listeners are thinking, I wouldn't mind trying this myself with my own patients. I mean, how do they go about finding some information and getting started with it?
Yeah, lynda.com is a great resource. They have a number of little modules to learn about Google Hangouts. But frankly, just going into YouTube and typing in how to start a Google Hangout I learned a lot just by doing that. Obviously, they're integrated together, so they have a lot of information available on there. And then throughout, as you're learning the process, Google has a massive archive of questions and answers that have already been. You can go in and see the questions that have already been asked, and you can find your answer right in there. They have a big community that you can ask questions to. And then, I mean, frankly, anytime Scott and I ran into an issue of some kind of a technical matter while we were doing them, we just went into Google and typed it in, and within 10 seconds we'd find an answer right there. So it's really simple for something like this to be able to find good resources to learn how to use it.
Yeah, great. And you said lynda.com, and that's spelled?
lynda.com.
Great. Thank you. I appreciate that.
Sure.
So, again, this conference is full of educators and key stakeholders across every aspect of continuing education. Any recommendations for them on how they might change their education? Because maybe it's not going to be that hour-long lecture, or it's not going to be as long. Maybe it's a short. So how can you give them some advice on how to tweak their educational designs?
Well, I mean, I think one thing that we're certainly seeing more and more of is, as you said, people don't just want to sit there looking at their computer screens for an hour. They want something that's going to be a little more, that's going to be shorter, more engaging, more interactive. And I think as professional educators, that is a lot of the ways that we have been thinking for the last few years, and will continue to think of kind of how to do that in our professional circles. So I think that's kind of a broader question than necessarily Google Hangouts on Air. Mm-hmm. But it kind of goes back to saying, okay, what tools are at my disposal? How can I use these tools to improve the quality of the education that we are going to be developing and providing?
Excellent.
And I'll add in that I think one of the things we've learned through this experience is that content really is king. And you can have, with the Google Hangouts, when maybe it's not the absolute most pristine, well-produced activity, but have had a lot of people view what we've done because of the content that was involved in it. And if you're giving people something that they're interested in, it doesn't matter so much what the actual format is that you're giving them if they're interested in what it is.
Great. Derek and Scott, thank you. We are out of time, but we appreciate your insights. It's been very interesting.
Thank you, Alicia.
Thanks for having us.
Great. You've been watching Lifelong Learning on ReachMD, the channel for medical professionals. This series is co-produced with the Alliance for Continuing Education in the Health Professions. For more information and a full library of medical broadcasts, please visit reachmd.com. I'm your host, Alicia Sutton, and we'll see you again soon. Thank you.
Thanks.